People can suddenly become ill or injured regardless of where they live or work. But you can make a difference or even save someone's life if you learn how to recognize and respond to common workplace emergencies. Hello, and welcome to the American Heart Association's Heart Saver First Aid course. In this course, you will learn the basics of first aid. You will learn about the most common, life-threatening workplace emergencies, how to recognize them, how to call for help, and how to perform life-saving skills before someone with advanced training arrives. This course will help you learn in several ways. Your student workbook covers all of the material in this course. This video will give you facts and show you important skills. You will also practice some of the skills. This will help you remember what to do in a real emergency. If you can demonstrate that you can do the skills taught in the course, you'll receive a Heart Saver First Aid card. After the course, the quick reference guide included in your student workbook will help you remember what to do in an actual emergency. You should keep it handy. To keep your skills fresh, review the information frequently and retake the course every 2 years or according to your company's policy. What you learn today could save the life of a coworker, a customer, or someone else. You can make a difference. Good luck. We hope you enjoy the course.
It's a heat stroke. Gotta get him up. Sir, we need to get you the water, okay?
To begin, let's talk about what we mean when we use the term first aid. First aid is the immediate care that you give someone with an illness or injury before someone with more advanced training arrives and takes over. First aid may help someone recover more completely or more quickly and may mean the difference between life and death. First aid can be given to treat illness or injuries ranging from minor to very severe. We should also define some terms you'll hear throughout the course. Someone who responds, moves, speaks, blinks, or otherwise reacts when you tap him and ask him if he's okay. You should know that during any type of emergency, it's possible that someone might stop responding. If this happens, and you know how, you should check to see if the person needs CPR. If you don't know CPR and you aren't learning it today, give hands-only CPR. To learn about hands-only CPR, go to www.handsonlycpr.org. Also, if you don't know CPR, the emergency dispatcher might be able to tell you what to do. Stay with the person until someone with more advanced training takes over. Since we'll talk about a variety of injuries and illnesses, let's learn about some first aid basics you need to know. These will apply in all emergencies.
Take him back there. That'd be great. All right, thanks.
You're Brian Jones, right?
Yeah.
Hi, I'm Susan. I'm an employee here like you, but I also serve as the Emergency Response Plan Supervisor. I heard you've agreed to be a first aid responder here at work?
Yeah, but listen, I don't know anything about first aid.
Oh, that's not a problem. We'll send you to the American Heart Association Heart Saver First Aid course. Teach you everything you need to know.
Does that mean I'll need to help out every time someone gets really sick or gets injured?
Well, here at work, you'll be expected to help. When you're outside of work, you can use your first aid skills if you want to, but that's up to you.
Yeah, but what if I make a mistake? I mean, can I get into any kind of legal trouble?
Oh, listen, nobody expects you to have the knowledge or skills of a professional rescuer. You just need to act responsibly when you're helping someone who's ill or injured. Anyway, don't worry. Your Heart Saver First Aid course will discuss everything and give you a chance to practice first aid skills.
Well, all right.
Come on, I'll show you the first aid kit. And it'll always be right in my office. Here it is. Now, when you're called to an emergency, bring this kit with you or send someone to get it. Our first aid kit contains the supplies that we might need in case of an emergency. Now, other companies might have first aid kits with different supplies, depending on the kind of work they do.
It sure looks like a lot of stuff.
Don't worry. You'll learn how to use most of this in your first aid course. Just remember, it's always a good idea to check the first aid kit before the beginning of every shift and make sure it's complete. Of course, if you use something, please replace it. That way you'll know that the kit is ready to go.
Okay, that makes sense. What's an AED?
An AED is used to shock the heart. Not all companies have one, but we do.
So, what if someone gets hurt and they don't want my help?
Well, that's a good question. Anyone who is awake and understands has the right to refuse your help. When you arrive at the person's side, introduce yourself, tell them that you're trained in first aid, and ask if you can help. Now, if that person doesn't want your help, call our emergency response number and then stay with them until help arrives. If that person can't answer or seems confused, well, just assume that he wants your help. Brian, you're going to be fine. You're going to do great. The important thing is that you want to learn how to help.
If giving first aid is part of your job description, remember the following. While you're at work, your employer may require you to provide first aid when it's necessary, but you can choose whether or not to help when you're off duty. Before you provide first aid, ask if the person wants your help. If they say no, call your emergency response number and wait for help. If they can't respond, assume they want help. Always know where your workplace first aid kit is located, and be sure to keep it stocked before and after an emergency. You may find the person needing first aid in a dangerous place. The person may be in a room with poisonous fumes or on a busy street or parking lot. Before you start, always check to see if the scene is safe and keep looking to make sure it stays that way. Be aware of any danger for you, the ill or injured person, and anyone else nearby.
Hey guys, I need your help. I need for you to go to the office and call 911 and bring back the first aid kit. I need for you to keep the cart and the workers back.
Shouldn't we help you move him to a safer place?
No, he shouldn't be moved just yet. I need for you to keep the scene safe by stopping the traffic so no one else gets hurt.
Okay. Hey guys, I need you to clear the area, please. Clear the area.
Sir, can you hear me? My name is Kelly and I'm trained in first aid. Is it okay if I help you?
Yeah, okay.
You can't help someone else if you're injured yourself. When you approach an ill or injured person, take a quick look around. Make sure the scene is safe. Usually, you shouldn't move someone who is ill or injured, but you may need to if the scene is unsafe. When you look around, check for these things. Is there danger for you or the ill or injured person? Only move an injured person if he is in danger or if you need to move him in order to safely provide first aid or CPR. Are others around to help? If so, have someone call your emergency response number or 911. If no one else is near, call for help yourself. Who is injured? Can you tell how many people are hurt and what happened? Where exactly are you? You'll need to tell others how to get to you. Another part of being safe is washing your hands to prevent illness. If possible, wash your hands before giving first aid, but always wash them with soap and water after tending to a sick or injured person. Germs can spread easily. If by chance blood or body fluids does get on you, wash it off with soap and lots of water right away. To wash your hands properly, wet them with clean running water, warm if available, and apply soap. Rub your hands together and scrub all over for at least 20 seconds. Then rinse your hands with lots of running water. Dry your hands with paper towels or an air dryer. If you can, use your paper towel to turn the faucet off so you don't recontaminate yourself. Remember, always wash your hands and wash them thoroughly. If you can't wash right away, use waterless hand sanitizer and wash your hands as soon as you can. Apply sanitizer to the palm of your hand, then rub your hands together until the sanitizer covers the surfaces of both hands and all fingers until dry. Body fluids, such as blood, can sometimes carry germs that cause diseases. Your first aid kit includes personal protective equipment such as eye protection and non-latex gloves to help keep you safe from blood and other body fluids while giving first aid. Since latex allergies are quite common and can be serious, you should always use non-latex gloves to protect others, even if you're not allergic to latex yourself. So, when is it appropriate to use personal protective equipment? Well, basically, whenever you give first aid or CPR to anyone outside your family or as part of your job responsibilities. However, when you give first aid at home or to your immediate family, you can decide whether you want to use gloves or other equipment. Sometimes your personal protective equipment may come in contact with blood of an injured person. You should always wear personal protective equipment whenever possible to keep from touching an ill or injured person's blood or body fluids. However, if the person's blood does make contact with your skin or splashes in your eyes or mouth, take these steps. Remove your gloves if you are wearing them. Immediately wash your hands and rinse the contact area with soap and lots of water. Rinse your eyes, nose, or inside of the mouth with plenty of water if body fluids have splattered in any of these areas. Report what happened to your company's emergency response plan supervisor as soon as possible. Then, contact a healthcare provider. Place all disposable equipment that has touched blood or body fluids, including the gloves you wore, in a biohazard waste bag or as required by your workplace. Now, as you can see, using gloves and taking them off correctly are important steps when it comes to your safety and the safety of others. So, we're going to take a few moments to practice taking off gloves. I'm going to demonstrate first, then you'll get a chance to practice. First, grip one glove on the outside near the cuff and peel it down until it comes off inside out. Cup it with your other gloved hand. Next, place 2 fingers of your bare hand inside the cuff of the glove that is still on your other hand. Peel that glove off so it comes off inside out with the first glove inside it. If there is blood on the gloves, place them inside a biohazard waste bag or as required by your workplace. If you do not have a biohazard bag, put the gloves in a plastic bag that can be sealed before you dispose of it. And of course, wash your hands well with soap and lots of water after you remove your gloves to prevent the spread of germs. Now, as we go through the course today, you're going to have a chance to practice skills that would require you to wear gloves. Instead of actually using gloves for every practice, you'll need to say out loud, "I'm wearing gloves," as you begin. This way, you won't have to actually wear gloves every time. Now, it's your turn to practice taking off gloves correctly. Your instructor will pause the video so that you can get ready. Okay, you should be ready to practice removing your gloves. If you haven't already, go ahead and put your gloves on. You'll practice along with the video as we go. Since you may not have a biohazard waste bag, you can just say, "I will now dispose of the gloves properly" at the end of the practice. After practice, your instructor will test you on taking off gloves. So, get ready and begin. First, grip one glove on the outside near the cuff and peel it down until it comes off inside out. Cup it with your other gloved hand. Next, place 2 fingers of your bare hand inside the cuff of the glove that is still on your other hand. Peel that glove off so that it comes off inside out with the first glove inside it.
I will now dispose of the gloves properly.
Your instructor will now pause the video to test your glove removal skills. When giving first aid, the sooner you realize that there's a problem and ask for help, the better it is for the ill or injured person. Your company should have an emergency response plan that includes when, how, and who to call for help. Many times, this is the most important thing you can do. The American Heart Association's chain of survival shows the most important actions you can take to deal with life-threatening emergencies. The first link in the adult chain is to recognize the emergency and call for help. This is followed by early CPR with an emphasis on compressions, rapid AED use, effective advanced care, and coordinated care afterwards. Your company should have some instructions about when you should call the emergency response number. But generally, you should call for help whenever someone is seriously ill or injured, or you are not sure what to do in an emergency. Knowing how to call for help is as important as knowing when. Your company's policy may be to call security, a response team, or the local emergency response number. Some areas use the number 911 to contact emergency medical services, or EMS. Others have a specific emergency response number. Make sure you know how to call for help for your location. Be sure to write your emergency response number on your quick reference guide, in your student workbook, the first aid kit, and near the telephone where everyone can see. In an emergency, if someone else is available, send that person to call for help and get the first aid kit and AED while you stay with the ill or injured person and begin first aid. If no one else is available and immediate care isn't needed, you'll have to call for help yourself. When the emergency dispatcher answers your call, he will ask you some questions about the emergency to get help to you as fast as possible. Plus, an emergency dispatcher may be able to tell you how to do CPR, use an AED, or give first aid.
The Acme Company at 110 Fifth Avenue. Right, phone number 405.
Answer all the questions the dispatcher asks of you, and do not hang up until the dispatcher tells you to.
Breathing.
Answering the questions will not delay help.
Does have a pulse.
The video will now pause to allow you to write down the emergency response number for your location. In an emergency, once you're sure the scene is safe, you must find out what the ill or injured person's problem is before you give first aid. It's best to do this in an orderly way, looking for life-threatening problems first. Then you can look for other problems. Let's look at a scene in which a rescuer follows the steps to finding the problem. Then you'll get a chance to practice doing the same along with the video.
Hey. Hey! Hey, are you okay? Help! I need some help over here. Call 911, get the first aid kit and AED.
I'm trained in first aid.
Good, thanks. Looks like he's breathing.
EMS is on the way. Here's the first aid kit and AED.
I don't see any bleeding or any other obvious sign of injury.
Maybe he has a medical condition.
He isn't wearing a medical bracelet, maybe a necklace. Here it is. He's diabetic.
The video will now pause to let you get into position to practice finding the problem. Pair up with a partner. When the video restarts, you will take turns being the rescuer and the ill or injured person, practicing along with the video. Now, it's your turn to practice finding the problem. After you get a chance to practice, your instructor will test you on your skills, so follow along with the video as closely as possible. You should already be in position to practice, so get ready and begin. First, check the scene to be sure it is safe.
Okay, the scene is safe.
Next, tap the ill or injured person's shoulder and shout to check for a response.
Hey, are you all right? Are you all right?
If the person does not respond, call or send someone to call for help and get the first aid kit and AED.
You, call 911 now, get the first aid kit and the AED.
Check to see if the ill or injured person is not breathing or only gasping.
He's breathing.
Look for any obvious signs of injury, such as bleeding, broken bones, burns, or bites. You'll learn about these soon. Also look for any type of medical information jewelry.
I'm checking for medical ID jewelry.
As a first aid rescuer, you may learn private things about your coworkers. But keep private information private at work. Only share information about an ill or injured coworker with EMS rescuers and your emergency response plan supervisor.
Hey, Brian, I heard you did a really good job helping Mr. Davis.
Thanks. It felt good knowing what to do. The first aid training really helped.
I'm glad to hear that. Oh, there's just one more step. Our company requires you to fill out a report after you've given first aid.
Okay, I'll get this done right away. Oh, and thanks again, Susan.
Sure.
This concludes our discussion of the first aid basics. By now, you should know how first aid can help and when to give it, how to protect yourself and others when giving first aid, how and when to call for help, how to find out what the problem is, and what to do after an emergency. The video will now pause so that your instructor can go over some first aid basics review questions with you. Medical emergencies are usually the result of a common medical condition, such as diabetes or a severe allergy. Some conditions can often cause breathing problems, so we'll take a look at how to give first aid for those problems first. Breathing is usually smooth and easy, and we hardly notice it. If someone suddenly has trouble breathing, it's an emergency. You can tell if someone is having trouble breathing if the person is breathing very fast or very slow, is having trouble with every breath, has noisy breathing, you hear a sound or whistle as the air enters or leaves the lungs, can only make sounds or speak more than a few words at a time in between breaths, although the person is trying to say more. Someone with a medical condition, such as asthma, usually knows about the medical condition. He often carries inhaler medicine, which can help him feel better within minutes of using it. At times, the person can have such a hard time breathing that he needs help using his inhaler. When someone has a breathing problem, first make sure the scene is safe. Ask the person if he has medicine and if he needs help using it. If he asks you to get it for him, make sure you get all the parts. Ask the person if you have the right medication, and if so, either help him assemble it or do it for him. To assemble an inhaler, first, remove the cap and hold the inhaler upright. Then shake the inhaler. If one is available, attach a spacer to the inhaler and remove the cap on the spacer. To help someone use an inhaler, have them first tilt their head back slightly and breathe out slowly. Have them place the spacer in their mouth and push down on the medicine canister, then breathe very deeply and slowly for about 3 to 5 seconds. Then have the person hold their breath for about 10 seconds. And then breathe out slowly. Call for help if the person has no medicine, the person does not get better after using medicine, the person's breathing gets worse, the person has trouble speaking or stops responding. Stay with the person until someone with more advanced training takes over. Be prepared to check to see if CPR is needed, and give CPR if you know how. Now, let's talk about a common breathing problem, choking. In adults, choking is often caused by food blocking the airway. The block in the airway may be mild or severe. If the block in the airway is mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you are worried about the person's breathing, call for help.
Hey, if it isn't the muffin thief.
Always.
This guy's always taking it.
Stop bringing that.
Every time. Hey, Philip, are you choking? I'm gonna help you, okay?
If the block in the airway is severe, the person cannot breathe, talk, or make sounds. They may also make the choking sign by holding their throat. If this happens, you must act right away and give abdominal thrusts to try and clear the airway. When someone's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think someone might be choking, first ask if the person is choking.
Are you choking?
If the person nods that he or she is choking and cannot talk, you must act.
Okay, I am going to help you.
We're not actually going to practice choking, but you can perform the following steps to help someone who is choking. When a person is choking, you'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, kneel or stand firmly behind the person and wrap your arms around his waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she stops responding. If you cannot remove the object, the person will stop responding. If this happens, follow these steps. Call or have someone else call your emergency response number or 911. Check to see if the person needs CPR and give it if needed and you know how. Continue CPR until the person speaks, breathes, moves, or until someone with more advanced training takes over. Remember that a 911 dispatcher often can give you instructions on how to do CPR if needed. If the choking person is in the late stages of pregnancy or is very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give the chest thrusts. Many allergic reactions are mild. The signs of a mild reaction are a stuffy nose, sneezing, itching around the eyes, itchy skin, or a rash. However, some reactions that seem mild can become severe within minutes. A number of things can cause a severe allergic reaction. Eggs, peanuts, chocolate, and insect bites and stings, especially bee stings. The signs of a severe allergic reaction are trouble breathing, swelling of the tongue and face, or fainting or dizziness.
Hey, Ray, the coffee man. Means we're halfway done.
People who know they have severe allergic reactions may carry an epinephrine pen with them and know how to use it. This is a prescribed device that has medicine in it that can help such a person. There are a few types of epinephrine pens, but they work basically the same way. It's important that you be ready to help if needed, because someone with a severe allergic reaction can die if they don't get first aid right away.
He's a foot.
Hey, Bob, you okay?
I'm having trouble breathing.
Oh, no. Bob, you drank my coffee by mistake.
I'm training first aid. Can I help?
Bob drank some of my coffee. It's got hazelnut in it. He's allergic to nuts.
I have an epinephrine pin in my lunchbox. Call 911 and get some help, right? I got it. Bob, can you give this yourself?
If the person is able, let him give the injection. If the person can't give the injection, you can help give it if you have been trained and your state and workplace allow it.
All right, I'm going to inject this to the side of your thigh, okay? It's got to be for 10 seconds.
The needle is designed to go through skin and through clothing. Hold the epinephrine pen in place for about 10 seconds. When you take it out, be sure to pull the pen straight out. After you take it out, make sure you don't put your fingers over the end that has been pressed against the person's thigh, because that's where the needle is. Rub the injection spot for about 10 seconds.
Breathe easy, buddy. Breathe easy. Come on.
Stay with the person until someone with more advanced training arrives and takes over. After using the injector, put it in a safe container according to your company's policy. Note the time of the injection for EMS rescuers and give them the tube for proper disposal. In a moment, you're going to practice using the epinephrine pen. But first, we'll show you a demonstration of what you need to do during the practice. Pay close attention, because you'll be demonstrating the same steps to your instructor afterwards.
Okay, the scene is safe. You, call 911 and get the first aid kit.
To use the epinephrine pen, make sure you are holding the pen correctly. Then take off the safety cap. Hold the pen in your fist without touching either end, and press the tip of the injector hard against the side of the person's thigh, about halfway between the hip and the knee. Hold the pen in place for about 10 seconds. Pull the pen straight out, making sure you don't put your fingers over the end that has been pressed against the person's thigh. Rub the injection spot for about 10 seconds.
I delivered the injection at 2:37 p.m., and I'll dispose of the needle properly.
Okay, now it's your turn to practice using an epinephrine pen. While the video is paused, you'll pair up with a partner and take turns practicing. Then your instructor will test you afterwards. A heart attack is a serious medical emergency. A person who is having a heart attack usually can respond, but may deny having a problem. If someone has signs of a heart attack, call the emergency response number or 911 right away.
Yeah, this wall right here, Hank, I think this is going to have to go. It's kind of in our way.
But what about elevation E? I mean, do you think that should stay?
I'm trained in first aid, Jim. Can I help?
Yeah, okay.
Can you tell me what's wrong?
My chest is really tight. Just let me rest for a minute, and I'll be okay.
Call the emergency number. The extension is 212. Tell them that someone is having a tightness in their chest.
All right, anything else?
Yeah, give me the first aid kit and the AED from the break room.
Wait a minute, Hank. Just give me a minute. This is probably just heartburn from that lunch that Sid bought me. You know, I don't want to worry anybody. And if we don't make this deadline, I'm going to feel really bad. My chest is really tight.
Jim, listen to me. Do you have any allergies to aspirin?
No.
Have you had any bleeding lately? Have you ever had a stroke?
No, neither.
Give me the first aid kit.
Oh.
EMS is on its way.
These are 2 chewable aspirin. This will help, Jim.
Oh, thanks.
Many people with an uncomfortable feeling in the chest don't want to believe that it could be a heart attack. If someone has signs of a possible heart attack, you must act and call for help right away, even if the person doesn't want you to. Act quickly. The first minutes of a heart attack are the most important. That's when a person is likely to get worse or even die. These first minutes are also important because many of the treatments for heart attack will be most successful if they are given soon after the signs of a heart attack begin. Signs of a heart attack may include chest discomfort in the center of the chest that lasts for more than a few minutes or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. The uncomfortable feeling may be in other areas of the upper body, such as one or both arms, the back, neck, jaw, or abdomen. shortness of breath. Other signs may include cold sweat, nausea, or lightheadedness. The uncomfortable feeling of a heart attack is usually in the chest and may involve either one or both arms, the neck, the jaw, or the back between the shoulder blades. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Call your emergency response number or 911. Ask someone to get the first aid kit and AED if available. If the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, give him either 2 low-dose or 1 regular aspirin. Be prepared to check to see if CPR is needed and give CPR if you know how. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the quality of recovery. Fainting is a short period when a person briefly stops responding, usually less than a minute, and then seems fine. A person who faints usually gets dizzy, then stops responding. Fainting most often happens when someone stands without moving for a long time, especially if it is hot, suddenly stands after squatting or bending down, has a heart condition, or receives bad news.
Hi, I'm Charlie. No first aid. Can I help you?
Yes, please, thanks. I don't know what's wrong. I feel dizzy.
Why don't we lay you down until the dizziness goes away?
Yeah, okay.
Okay.
If you're asked to give first aid when the person is dizzy but still can respond, make sure the scene is safe and help the person lie flat on the floor. After a person faints and then starts to respond, you should do the following. Ask the person to lie down on the floor until the dizziness goes away. Look for injuries that may have been caused by the person's fall. If the person doesn't improve or stops responding, call your emergency response number or 911. Diabetes is a disease that affects levels of sugar in the blood. Too much or too little sugar causes problems. Some people with diabetes take medication to maintain their sugar levels, but if a diabetic experiences low blood sugar, his behavior can change. Low blood sugar can occur if a person with diabetes has not eaten or is vomiting, has not eaten enough food for his level of activity, or has injected too much insulin. If low blood sugar does occur in a diabetic, the person may become irritable or confused, hungry, thirsty or weak, sleepy or sweaty. Or the person might even have a seizure. You'll learn more about seizures a little later.
I don't get it. I don't understand. None of this seems right to me. They're all wrong.
Steve, you're not acting like yourself.
I'm trying to finish these student reports. What time is it? I didn't eat yet.
I see you're wearing a medical bracelet.
Yeah, I'm diabetic.
Julie, get Steve a regular soda, fruit juice, or a sugar packet. Don't bring back a diet soda. It doesn't have sugar in it. He needs sugar. Steve, it's gonna be okay. I want you to sit quietly. Would you feel better lying down?
No.
Can you eat something and swallow?
Yeah.
Signs of low blood sugar can come on very quickly in someone with diabetes. If you see signs of low blood sugar, you should take the following first aid actions. If the person can sit up and swallow, ask him to eat or drink something with sugar. If he can't sit up or swallow, don't force him. The food or drink might include fruit juice, milk, a regular soda, or even a packet of real sugar or honey. Since the problem is low blood sugar, be sure to give the person something with sugar in it. have the person sit down quietly or lie down. Call or have someone call your emergency response number or 911. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or bursts. Some people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, it's important to recognize the signs of a stroke quickly and get medical care fast. The warning signs of a stroke are sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, or sudden severe headache with no known cause.
Hey, it's Lonnie. I'm training first aid. Can I help you? What's the matter?
Please, help. I feel funny. I can't move my arm.
It's okay. We'll get you help and I'll stay with you. Hey, Joel! Call 911. Tell them we have a woman who is suddenly having trouble speaking and can't move her left arm. Bring the first aid kit and the AED back with you. It's okay, Marlo. Do you want to sit or lie down?
Sit.
If you see signs of a stroke, make sure the scene is safe. Call or have someone call your emergency response number or 911 and get the first aid kit and AED. Note the time when the stroke signs first appeared. And be prepared to check to see if CPR is needed and give CPR if you know how. A seizure is abnormal electrical activity in the brain. Most seizures stop within a few minutes. A medical condition called epilepsy often causes seizures, but not all seizures are due to epilepsy. Seizures can also be caused by head injury, low blood sugar, heat-related injury, poisoning, or sudden cardiac arrest. During a seizure, a person may lose muscle control, fall to the ground, or stop responding. And the person usually has jerking movement of the arms, legs, and sometimes other parts of the body. A person may bite her tongue during a seizure. You can give first aid for that injury after the seizure is over, since most seizures stop within a few minutes. After a seizure, it is not unusual for the person to be slow to respond, confused, or fall asleep. The most important first aid action for a person having a seizure is to protect them from injury by moving furniture or other objects out of the way and by placing a small pad or towel under the person's head if possible. Then, call your emergency response number or 911. After a seizure, quickly check to see if the person needs CPR. If she does, and you know CPR, provide it. Stay with the person until she starts responding. If the person is having trouble breathing because of vomiting or fluids in her mouth, and you don't suspect a head, neck, or spine injury, roll the person to her side. There are also some myths about what you should do to help someone who's having a seizure. Some of these can actually harm a person instead of helping them. The actions we just listed describe the best way to help someone with a seizure.
What happened?
She was hit by a forklift.
My name is Jessica. I'm trained in first aid. May I help you?
Yes.
Okay, you and you stand on either side and watch for safety hazards.
This woman has been struck by a moving vehicle and could have multiple injuries, including shock. Shock occurs when cells in the body don't get enough blood. This can happen if the person loses a lot of blood that you may or may not be able to see, has a severe heart attack, or has a severe allergic reaction. A person in shock may feel weak, faint, or dizzy, feel nauseous or thirsty, have pale or grayish skin, be restless, agitated, or confused, or be cold and clammy to the touch.
How are you feeling now?
My stomach's starting to hurt really bad. That's where the forklift hit me. And I'm cold and weak and kind of dizzy. Please help me.
You could be bleeding inside your body. We've already called for help, but what I can do is I can try to help keep you warm. I'm going to put a blanket over you, okay?
First aid actions for shock are: make sure the scene is safe. Call your company's emergency response number, or 911, and get the first aid kit and AED. Help the person lie on her back. Cover the person with a blanket to keep her warm. Be prepared to check to see if CPR is needed, and give CPR if you know how. This concludes our discussion of medical emergencies. By now, you should know how to recognize and respond to several common medical emergencies, such as breathing problems, including choking and allergic reactions. You've learned how to use an epinephrine pen, how serious a heart attack can be, and how to respond to emergencies involving fainting, low blood sugar, stroke, seizure, and shock. The video will now pause so that your instructor can go over some medical emergency review questions with you. Much of the first aid you will give will be for injury emergencies. Many common workplace injuries involve bleeding. We've divided bleeding into two types. Bleeding you can see because it is bleeding on the outside of the body, and bleeding you can't see because it is inside the body. Bleeding that you can see can be frightening, but the fact is that you can stop most bleeding you can see with pressure alone. The most important thing is to stay calm. Bleeding often looks a lot worse than it is.
Ow! Oh, man, my knife slipped. I just cut my hand.
It's okay. It's okay. Listen, I know first aid. I'm going to help you out, all right?
Yeah, sure.
Can you go to the break room, bring me the first aid kit, and some safety glasses, and keep these people away from here if you could?
Can you step back, please? Let's give them some room.
I really appreciate this, man. Whew.
Put this down over the bleeding and press down while I put on my gloves.
Okay. Oh, you know, I have worked here for 5 years. This is the very first time this has happened.
It's okay. I'm going to try and stop the bleeding, but I'm going to have to press down hard.
Okay. Oh.
It's bleeding through. I'm going to have to put some more on.
Well, can you take that bloody one off?
No. It might pull out clots and make the bleeding worse.
Okay.
I'm going to press down harder on top of these extra gauze. I should be able to stop the bleeding with just a little more pressure and some more time.
Okay.
Looks like it stopped bleeding now. Let's get a bandage on.
Thanks a lot.
Take the following first aid actions to stop bleeding you can see. Be sure the scene is safe for you and the injured person. Send someone to get the first aid kit and AED. If possible, have the person apply direct pressure. Wear personal protective equipment. Apply gauze dressings from the first aid kit and put direct pressure on the dressings over the bleeding area using the flat part of your fingers or the palm of your hand. If the bleeding doesn't slow or stop, add more dressings and press harder. Do not remove any gauze once it's in place. Keep pressure on the wound until it stops bleeding. If you can't keep pressure on the wound, wrap a bandage firmly over the dressings to hold them in place. Once the bleeding has stopped, if you haven't already done so, wrap a bandage firmly over the dressings to hold them in place. Now, we'll show you a demonstration of what the steps for stopping bleeding you can see look like. You'll practice what you learn afterwards, so pay close attention. First, make sure the scene is safe for you and the injured person.
Okay, the scene is safe. You, call 911 and get the first aid kit. Take this and apply pressure over the cut. I'm wearing gloves.
Use pressure and gauze to stop the bleeding. If bleeding does not stop, apply more gauze dressings and more pressure. Do not remove any gauze once it's in place.
The bleeding has not stopped.
You should be able to stop most bleeding with pressure over plenty of gauze. Call for help if there's a lot of bleeding, if you can't stop the bleeding, or if you're not sure what to do. Using pressure with a dressing helps you stop bleeding, but to protect the injured body part, you should use a bandage. Let's talk now about the difference between a dressing and a bandage so you can understand how they work together. A dressing is a clean material used directly on a wound to stop bleeding. It can be a piece of gauze or any other clean piece of cloth. A bandage is material used to protect or cover an injured body part. A bandage may also be used to help keep pressure on a wound. If necessary, you can hold gauze dressings in place over a wound with a small bandage. The bandage can be applied with enough pressure to help stop the bleeding, but it's best if a dressing is placed on the actual wound first. After you've used direct pressure and dressings, if available, to stop bleeding, apply the bandage over the dressings to keep pressure on the injury. The video will now pause for you to practice stopping bleeding using gauze dressings and bandages. Pair up with a partner and take turns being the injured person and rescuer. Your instructor will test your skills after you get a chance to practice. If an arm or a leg has severe bleeding, that is, blood keeps flowing no matter how much direct pressure you apply or for how long, you can try to use a tourniquet to stop the bleeding. The best tourniquets are pre-made or manufactured ones. They include a strap that you wrap around the injured person's body part and a straight stick-like object called a windlass, which you will use to tighten the tourniquet to stop the bleeding. However, you can make a tourniquet out of a piece of cloth and any sturdy object that is similar to a windlass, such as a small hand tool if necessary. To use a handmade tourniquet, first make sure the scene is safe. And wear personal protective equipment. Fold the cloth or bandage so that it's long and at least 1 inch wide. Wrap the bandage 2 inches above the injury if possible. Tie the ends of the bandage around a stick or something similar. Turn the stick to tighten the tourniquet. Continue tightening until the bleeding stops. Secure the stick so the tourniquet stays tight. Note what time the tourniquet was placed and get medical help as soon as possible.
Oh! Oh! Oh, man.
Dave, grab your cell and call 911. Hey, Tommy, cut that saw off for me. Be careful. Keep that area clear back there, too.
Boss, I'm sorry. The chain broke. It snapped right back. Oh, yeah. It cut me pretty badly. Right below the elbow. Oh, kind of weak.
Let's get that bleeding under control. Here you go. All right, listen. We need you to put that gauze in your arm and put pressure on the cut, okay?
Hey, we're out on the edge of town, sir. Dispatcher says it's going to take a little bit.
I don't think this is helping, boss. It's still bleeding pretty badly.
All right. We need you to get some more gauze on that arm, okay? Yeah, press down on that. There you go. You're doing good. Listen, buddy. Help's on the way, but in the meantime, I'm going to put this tourniquet on your arm. Get that bleeding stopped, okay?
I'm feeling kind of cold.
Now, you're just going into shock. You get that bleeding stopped.
Ah! Oh, boss, that hurts.
I know, buddy. Sorry. But looks like it's working. Hey, what time is it?
2:15.
Can you grab that blanket out of the first aid kit for me? Thanks.
Take the following actions when using a tourniquet. First, make sure the scene is safe for you and the injured person. Call your emergency response number or 911 and get the first aid kit and AED. Use personal protective equipment. Place the tourniquet about 2 inches above the injury if possible. Tighten the tourniquet until the bleeding stops. Note what time the tourniquet was placed on the body. Once you have the tourniquet in place, leave it alone until someone with more advanced training arrives and takes over. As a rescuer, you may be asked to help someone who has a nosebleed. There are some things you can do to help stop this bleeding.
Jess, they called and said you were having trouble. Can I help?
Yeah, thanks.
What happened?
I need help. I don't know what happened. My nose just started bleeding.
Okay, well, sit down for me. No, lean your head forward. You don't want to lean your head back when you're trying to stop a nosebleed. Okay. All right. Now, I'm going to have to pinch your nose pretty hard with this gauze for several minutes, okay?
Okay.
A nosebleed is bleeding you can see, so the first aid action is to stop the bleeding with pressure. First, make sure the scene is safe. Get the first aid kit and put on protective equipment. Press both sides of the nostrils while the person sits and leans forward. Place constant pressure on both sides of the nostrils for a few minutes until the bleeding stops. If bleeding continues, press harder. Call your emergency response number or 911. If bleeding does not stop in about 15 minutes, the bleeding is heavy, such as gushing blood, or if the injured person has trouble breathing, check for signs of shock. Like other bleeding you can see, bleeding from the mouth can usually be stopped with pressure. A mouth injury can be serious if blood or broken teeth block the airway and cause breathing problems. When giving first aid to a person who is bleeding from the mouth, first make sure the scene is safe.
Okay, sit right there for me.
If bleeding is coming from the tongue, lip, or cheek, and you can reach it easily, press with gauze or a clean cloth.
Here, put this where it's bleeding. Press down on it.
Call or ask someone else to call your emergency response number or 911 if you can't stop the bleeding or the person has trouble breathing. Sometimes when a person suffers a mouth injury, one or more teeth may become broken, loose, or knocked out. This can be a choking hazard. First, make sure the scene is safe for you and the injured person. Send someone to get the first aid kit. Put on personal protective equipment. Check the person's mouth for any loose or missing teeth or parts of teeth. Clean the area where the tooth was located with clean water. If a tooth is loose, have the person bite down on a piece of gauze to keep the tooth in place and call a dentist. Apply pressure with gauze to stop any bleeding at the empty tooth socket. If a tooth has come out, put the tooth in a cup of milk or clean water and suggest to the injured person immediately take the tooth and visit a dentist or emergency department. Tell the person to talk to a dentist if a tooth changes color after an injury. If a tooth is merely chipped, gently clean the injured area and call a dentist. It may be possible for a dentist to reattach a loose tooth, so when handling one, hold it by the crown, not by the root, the part that was in the person's gum. Make sure you keep the tooth out of the person's mouth. A person's eye can become irritated from a scratch or a small or large object in the eye. Usually, it's just a small piece of dirt or flying particles. The following are typical signs of eye injuries: pain in the eye, trouble seeing, bruising, bleeding, redness or swelling. Follow these steps for eye injuries. First, make sure the scene is safe. Get the first aid kit and put on personal protective equipment. Call your emergency response number or 911 if the eye is hit hard or punctured. Tell the person to keep both eyes closed. If there is an irritant in the eye, such as sand, use lots of running water to rinse the eye. If the object does not come out with rinsing, or if the person complains about extreme pain, call or ask someone to call your emergency response number or 911. Tell the person to keep her eyes closed until someone with more advanced training takes over. Puncture wounds occur when a person is injured by a sharp object like a stick or knife. If the object is stuck in the body, leave it there. Taking it out may cause more damage. Follow these steps for penetrating and puncturing injuries. First, make sure the scene is safe. Get the first aid kit and put on personal protective equipment. Call or ask someone to call your emergency response number or 911. Try to stop any bleeding you can see. Try to keep the injured person from moving. Amputation occurs when any part of an arm or leg is cut off. Amputated body parts, such as a finger or toe, may be able to be reattached. You can preserve a detached body part at room temperature, but it will be in better condition to be reattached if you keep it cool. Stop bleeding from the injured area with pressure. You may have to press for a long time with very firm pressure. Look for signs of shock. If you are giving first aid to a person with an amputation, first make sure the scene is safe. Get the first aid kit and put on personal protective equipment. Call or ask someone to call your emergency response number or 911. Try to stop any bleeding from the injured area with pressure. You may have to press for a long time with very firm pressure to stop the bleeding. If you find the amputated part, protect it. Stay with the injured person until someone with more advanced training arrives and takes over. To protect the amputated part, rinse it in clean water. Then cover it with a clean dressing. And place it in a watertight plastic bag if it will fit. Place the bag in another container with ice or ice and water. And label it with the injured person's name, the date, and time. Make sure it gets to the hospital with the injured person. Remember, do not place the amputated body part directly on ice because extreme cold can injure it.
So, where are we going for lunch?
Depends on what you're in the mood for. There's a lot of really good restaurants around here.
Bye.
Hey, Matt.
Hey.
Okay, so how did you want to deal with the convention? What time are they getting here?
Well, the check-in is at 2, so do we have all of those rooms ready?
Yeah, the maids are working on that right now, and you mentioned something about flowers.
Matt, what happened?
Oh, that ladder slipped out from under me. Then I hit my side on that cabinet on the way down.
Well, listen, I know first aid. Can I help you?
Yeah, please.
Okay. Listen, go use the house phone by the elevator, hit 9 to get an outside line, then dial 911, all right?
Sure, you got it. Is he all right?
Oh, my side's hurting really bad.
Yeah, you really got it right there.
Oh, I'm feeling dizzy.
Now, Matt, listen to me. You could have bleeding on the inside. Are you hurting anywhere else?
No, it's just my side.
Okay, well, listen, I want you just to lay there and be calm and lie still for me, okay? We've already called for help.
Yeah, okay. Thanks, Sam.
Let's talk about another kind of bleeding, bleeding you can't see. A strong blow to the chest or abdomen or a fall can cause injury and bleeding inside the body. You may not see signs of bleeding on the outside of the body or at all, or you may see a bruise on the skin over the injury. An injury that has caused bleeding you can't see could be minor or very severe. You should suspect bleeding inside the body if a person is injured by a car crash or being hit by a car, a fall from a height, an injury to the abdomen or chest, pain in the chest or belly after an injury, shortness of breath after an injury, coughed up or vomited blood after an injury, sports injuries such as slamming into other people or being hit by an object, signs of shock without bleeding you can see, or a knife or gunshot wound. This could cause bleeding inside the body that you can't see. If you suspect bleeding you can't see, you should first make sure the scene is safe. Get the first aid kit and AED and put on personal protective equipment. Call your emergency response number or 911. Have the person lie down and keep still. And check for signs of shock. Be prepared to check if the person needs CPR and give it if you know how. Now let's talk about how to recognize and provide first aid for head, neck, and spine injuries. Head injuries can happen if a person is struck hard on the head or falls from a height. Suspect a head injury if the injured person fell from a height, was injured by a strong blow to the head, was injured while diving, suffered an electrical injury, was in a car crash, was riding a bicycle or motorbike that was in a crash, especially when not wearing a helmet. Also suspect a head injury if an injured person does not respond or only moans or moves, is sleepy or confused, vomits, complains of a headache, has trouble seeing, has trouble walking or moving any part of the body, or has a seizure. The bones of the spine protect the spinal cord. Spinal cord carries messages between the brain and the body. If the spine is damaged, the spinal cord may be injured, and the person may have trouble moving her arms or legs, and may lose feeling in part of the body. Only twist or turn the head or neck if it's necessary to provide CPR, if you need to move the person out of danger, or if the person is having trouble breathing, is vomiting, or has fluids in her mouth. Suspect the spine bones might be damaged if an injured person is 65 years of age or older, was in a car or bicycle crash, has fallen from a height above the ground, has tingling or is weak in the extremities, has pain or tenderness in the neck or back, appears intoxicated or not fully alert, or has other painful injuries, especially of the head or neck. Follow these steps when giving first aid for a possible head or spine injury. First, make sure the scene is safe. Call your emergency response number, or 911, and get an AED and first aid kit. Minimize movement of the head and neck. Move the person only if she is in danger or if you need to provide CPR. If the person is having trouble breathing and is vomiting or has fluids in her mouth, roll her to the side. Injuries to bones, joints, and muscles are common in an active society. These injuries may include joint injuries, broken bones, and bruises.
Hey, Sean.
Hey, how you doing, Dean? You still coming on the hiking trip with us?
Yeah, I got new hiking shoes. I'm ready to go. I'm excited. Listen, I'm late for a meeting, so I'll talk to you later, all right?
Sounds good.
Ow. Ow, that hurts.
Oh man, I'm so sorry. I have some first aid training. Can I help?
Yes, of course.
Where does it hurt?
My ankle.
Your ankle, okay. I need you to get rid of that dolly. I need you to get me a first aid kit, a bag of ice with water inside of it, and a towel.
Okay. Do you want a chemical cold pack instead?
No. The thing is, it doesn't get cold enough. Water and ice are much better.
Man,
the break room's right down the hall.
Man, this really hurts.
Oh, man, I'm sorry.
I didn't even see the dolly.
The thing is, once we get the bag on there with the ice and the water, it's going to help with the pain. It's going to help with the swelling as well.
Okay.
All right, perfect. Thanks. We'll put this on here. Now we're going to set this on here for 20 minutes, and then we're going to take it off.
Okay.
All right, and make sure that after we take it off, don't walk on it until you get some medical attention, okay?
Hey, thanks, Sean. It's a good thing you were here. So much for the hiking.
When giving first aid for a person with a possible broken bone or sprain, first, make sure the scene is safe. Get the first aid kit and put on personal protective equipment. Cover any open wound with a clean dressing. Put a plastic bag filled with ice and water on the injured area with a towel between the ice bag and the skin for up to 20 minutes. Call or ask someone to call your emergency response number, or 911, if there is a large open wound, the injured part is abnormally bent, or you're not sure what to do. If it hurts, the person should avoid using an injured body part until checked by a healthcare provider. When someone has a suspected broken bone or sprain, or if a broken bone has come through the skin, you should protect the injury until someone with more advanced training can take over. Don't straighten any part that's bent or deformed, and don't move a broken bone that has come through the skin. Instead, cover the wound with a clean dressing and splint as needed. One way to try to keep an injured body part from moving is to apply a splint. This is generally left up to trained medical providers. However, you might have to apply a splint yourself if you are far from someone with more advanced training. First, make sure the scene is safe for you and the injured person. Find an object that you can use to keep the injured arm or leg from moving. Any rigid, straight object, such as a magazine, a stick, or piece of wood will do. The splint should be longer than the injured area and should support the joints above and below the injury. Apply the splint to the arm or leg securely above and below the injury without trying to straighten it or move it. After covering any broken skin with a clean or sterile cloth, tie or tape the splint to the injured limb. It should fit snugly but not cut off circulation. If you're using a hard splint like wood, make sure you pat it with something soft like clothing or a towel. Keep the limb still until the injured person can be seen by a healthcare provider. It will take an X-ray to know for sure if a bone is broken. Your instructor will now pause the video so you can practice splinting. Team up with a partner and your instructor will guide you. Burns are injuries that can be caused by contact with heat, electricity, or chemicals. Burns caused by heat can be a result of contact with fire, a hot surface, a hot liquid, or steam. Use cool water on burns. Ice can actually damage a burned area. It's best to keep a person with a burn from getting too cold.
Oh! Larry, you okay? I got coffee on my arm. It hurts. Hey man, let's get your arm underneath the water.
Follow these steps if the burn area is small. Make sure the scene is safe. Get the first aid kit and use personal protective equipment. Cool the burn area immediately with cold but not ice-cold water. Run cold water on the burn until it doesn't hurt. You may cover the burn with a dry, non-sticking, sterile, or clean dressing. Call for help if there's a fire, if the burn area is large, or if you're not sure what to do. Many people have heard about different ointments for burns. The only thing you should put on a burn is cool water and clean dressings. That's it, unless you're given other instructions by a healthcare provider. Remember, if there is a large burn or fire, call for help.
Oh no! He's on fire! Call 911! Stop moving around! Drop! Stop running! Drop to the ground and roll! Stop to roll! 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 Keep rolling! Roll! 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 Stop! It's out. It's out. It's all out. Your shirt's burnt. We're gonna have to get it off. Let's get it off.
First aid actions for burns caused by fire are to make sure the scene is safe and get the first aid kit. If you have any questions about safety, call for help. To give first aid to a person with a large burn, first, make sure the scene is safe. Get the first aid kit and call your emergency response number or 911. If the person is on fire, put the fire out. Have that person stop, drop, and roll. Cover the person with a wet blanket. Once the fire is out, carefully remove jewelry and clothing that is not stuck to the skin. Cover the person with a dry blanket. Check for signs of shock. Electricity occurs naturally in the form of lightning or from man-made sources like electric current from an outlet or electrical wire. Electricity can cause burns on the surface and injure organs inside the body. If electricity enters the body, it can cause severe damage. You may see marks or wounds where the electricity has entered and left the body. Injuries from electricity may seem very small, but the electricity can cause damage inside the body and even stop the heart. No one can tell how much damage there is inside the body based on the marks on the outside. If an electrical injury is caused by high voltage like a fallen power line,
Hey, somebody help!
Immediately notify the proper authorities. Call your emergency response number or 911 right away and bring the first aid kit and AED. Don't enter the area or try to pull wires or other materials until the power has been turned off. Don't touch a person if they are still in contact with the power source. Electricity can travel from the source through the person to you. It's best to turn the power off at its source, but only attempt this if you are trained to do so. The switch is usually near the fuse box. When giving first aid to someone with an electrical injury, first, make sure the scene is safe. Get the first aid kit and AED. Wear personal protective equipment. Call your company's emergency response number or 911. When it is safe to touch the injured person, see if he needs CPR. A healthcare provider should check everyone who has an electrical injury. This concludes our discussion of injury emergencies. By now, you should know how to recognize and respond to several common injury emergencies, including bleeding you can see, bleeding you can't see, and shock. You've learned how to recognize injuries to the head and spine, bones and joints, as well as injuries caused by burns and electricity. The video will now pause so that your instructor can go over some of the injury emergency review questions with you. In this part of the course, we'll discuss some of the most common environmental emergencies. Your quick first aid actions can speed recovery and may even prevent death.
Hey, look at that, Tom. There's some little animal over here. Come here, little buddy. Oh, it bit my hand.
Get away from it, Paul. It may be rabid. Look, I know first aid. Let's go to a safe area and take a look at your hand. Wow, it really got you. I'm going to rinse this wound out with some water. And just later be sure and wash it well with soap and water.
I can't believe it. It broke the skin. It's still bleeding.
I can stop the bleeding with gauze and pressure.
While many bites are minor, some may break the skin, bleed, and become infected. More importantly, a wild animal that bites someone could be carrying rabies. Here are some pictures of some animals that are known to carry this infectious disease. Rabies is quite common in bats. Anyone who has had direct contact with a bat or is unsure whether they have had contact with a bat, such as having slept in a room where a bat is present, should contact a healthcare provider. Follow these steps to give first aid to a person with an animal or human bite. First, make sure the scene is safe. Get the first aid kit. Put on protective equipment. For animal bites, call your emergency response number or 911. Clean the wound with a lot of running water and soap if available. Stop bleeding with pressure and dressings. For all bites that break the skin, call a healthcare provider. If there is a bruise or swelling, place a bag of ice and water wrapped in a towel on the bite area for up to 20 minutes. Snake bites are medical emergencies. You can sometimes identify the snake from its coloration or bite mark. If you're not sure, assume that it is poisonous. Signs of poisonous snake bites are pain at the bite area that keeps getting worse, swelling of the bite area, nausea, vomiting, sweating, or weakness.
Raphael, help! A snake bit me.
Stay back, stay back. It's all right, Carl. Calm down, calm down. Let me look at that. Call 911. See what the snake looked like?
What happens if it's poisonous? What do we do?
Yeah, relax, relax. Now, I'm going to go get this thing washed out. That's why we called 911. We don't know if it's poisonous or not.
Be careful around any snake, even if it's wounded. Back away and go around it. If a snake has been killed or hurt by accident, don't handle it. A snake could bite even when severely hurt or even close to death. It is best to leave a dead snake alone. If you need to move it, use a shovel or another object with a long handle to avoid close contact with the snake. If you don't need to move it, it's best to leave it alone. Some people have heard about other ways to treat a snake bite, but you should follow these steps. Make sure the scene is safe. Get the first aid kit and wear personal protective equipment. Ask another adult to move any other people inside or away from the area and call your emergency response number or 911. Tell the injured person to stay as still as possible, including the injured body part, and try to keep them calm. Remove any tight clothing and jewelry. Gently wash the bite area with running water and soap if available. We have all been bitten or stung by an insect at one time or another. The bite of a non-poisonous insect may cause some discomfort, redness, swelling, or pain at the bite area. The first aid actions for most insect bites are: wash the bite with water and soap if available. Put a bag of ice and water wrapped in a towel or cloth on the bite or sting. Some insect bites can be serious and even fatal if poison or venom is injected into a person or if someone has a severe allergic reaction to the bite. Some people can have a severe allergic reaction to an insect bite, especially a bee sting. People who have had these severe allergic reactions to an insect bite or sting usually have an epinephrine pen and know how to use it. They often wear medical identification jewelry.
Ow! Let me know. Oh, ma'am, are you okay?
I got stung by a bee.
Oh, I know first aid. Can I help you?
Yes.
Okay.
Bees are the only insects that leave their stingers behind. If stung by a bee, you should look for the stinger and remove it. Scrape the stinger and the venom sac away with something hard and dull that won't squeeze the venom sac. For example, a credit card, one edge of a pair of scissors, or the back or dull side of a knife. Wash the sting or bite area with running water and soap if available. Put a bag of ice and water wrapped in a towel or cloth over the area for up to 20 minutes. Watch the person for at least 30 minutes for signs of a severe allergic reaction and provide first aid using the skills you learned earlier.
Good.
The first aid actions for a severe allergic reaction to an insect bite or sting are the same as for any other severe allergic reaction. Make sure the scene is safe. Call your emergency response number or 911 and get the first aid kit if the person has signs of or knows they have a severe allergic reaction to insect bites or stings. Ask if the person has an epinephrine pen. If so, get the pen and help the person use it if you are allowed and trained to do so. If a bee stung the person, look for the stinger. Scrape it away using a dull edge as on a credit card. Wash the bite or sting area with a lot of running water and soap if available. Put a bag of ice and water wrapped in a towel on the bite or sting area for up to 20 minutes. Watch the person for at least 30 minutes for signs of an allergic reaction. The bite of non-poisonous insects cause mild signs of redness and itching at the bite area. The bite of a poisonous spider or scorpion, on the other hand, causes general illness. Signs of poisonous spider and scorpion bites are severe pain at the site of the bite or sting, muscle cramps, fever, headache, vomiting, breathing problems, seizures, or does not respond. If you know that a person has been bitten by a poisonous spider or scorpion or has any of these signs after such a bite, then do the following. Make sure the scene is safe. Call your emergency response number or 911 and get the first aid kit and AED. Wash the bite with a lot of running water and soap if available. Put a bag of ice and water wrapped in a towel on the bite. Be prepared to check to see if CPR is needed and give CPR if you know how. Ticks are found in wooded areas. They attach themselves to exposed parts of the body. Many ticks are harmless. Some carry serious diseases. If you find a tick, remove it as soon as possible. The longer the tick stays attached to a person, the greater the person's chance of catching a disease. To remove a tick, grab the tick as close to the skin as possible with a tweezers or tick removing device. Try to avoid pinching the tick. Lift the tick straight out of the skin without twisting or squeezing its body. If you lift the tick until the skin tense and wait several seconds, the tick may let go. Wash the bite area with running water and soap if available. If you are in an area where you know that tick-borne illness exists, suggest that the person see a healthcare provider and place the tick in a plastic bag to take with them. Heat-related emergencies can result from exposure to extreme heat outdoors or in the workplace. These emergencies range from mild to life-threatening. You should try to recognize and give first aid for heat-related emergencies early because someone with mild signs can get worse quickly and develop a dangerous condition called heat stroke. The mildest form of heat-related emergency is called heat cramps. Signs include muscle cramps, sweating, and headache.
Clint, you okay, man?
Man, I feel awful. My leg hurts, my stomach hurts, my head's just throbbing.
Well, I know first aid. You want me to help?
Yeah, please.
Man, looks like you're getting overheated. Jeff, grab the first aid kit out of the van.
You got it.
Alan, grab a sports drink from the ice chest. Oh, and bring back some ice and water in one of those plastic bags next to the chest, okay?
Okay, you got it.
Okay, first thing, we need to get you over to the shade. If I help you, you think we can make it to those trees?
Yeah, sure.
Okay, you ready?
Yeah.
All right, there we go. You think you can swallow a sports drink? It's got electrolytes and sugar in it. Make you feel better.
Sure.
Okay. You said your leg was aching. Is it okay if I put a bag of ice and cold water on it?
Yeah, please.
All right. There you go. Set it down.
Oh, yeah.
All right.
That feels better already.
Okay.
Thanks.
Actions to help someone with heat cramps include: be sure the scene is safe. Send someone to get the first aid kit. Wear personal protective equipment. Have the person with heat cramps rest and cool off. Have the person drink something with sugar and electrolytes, such as juice or a sports drink or water, if these aren't available. If the person can tolerate it, apply a bag with ice and water to the cramping area for up to 20 minutes. A mild heat-related emergency can get worse if left untreated. And mild heat-related signs are a warning that someone may get worse unless you take action. Heat exhaustion is a more serious condition that can often turn into heat stroke if not treated. The signs of heat exhaustion are nausea, dizziness, vomiting, muscle cramps, feeling faint or fatigued, or heavy sweating.
Right.
They're going to be taking that all the way inside.
Going all the way to the back room there?
There should be another box that has all
The Fabergé eggs.
all the way in. That's the box.
All right. Okay, so that's that one right there. Okay. So we only should have about 3 or 4 more boxes, and then we're going to be good for the day.
Take that one all the way up. Yeah, and then we'll get the rest of the box.
Greg, are you okay, man?
Oh, hot.
So, okay, I know first aid, so I can help you, all right?
Yeah.
What's the matter?
My leg's cramping.
Is he okay?
I don't know.
Donovan, can you go get the first aid kit out of the cab of the truck?
Is there anything I can do, Damon?
Yes. Can you call 911 and tell them that we have somebody with a heat emergency?
Absolutely. You might bring him inside because it's a lot cooler in there.
That's a good idea. Can you help me up? All right. Let's get him up. Let's go. Come on, Greg. Almost there, man. All right. Here we go. Great. Donovan, check with Miss Dawson, see if she has any spray bottles that we can put some cold water in.
Sure, boss.
Corby, can you check the cooler outside and see if there's any sport drinks left?
You bet.
Right. Okay, Greg, we need to get as much of your clothes off as we possibly can. We're going to start with your work shirt, your shoes and socks. Gonna need you to work with me here, though. All right, here we go. There we are. Right. Okay.
Here's a spray bottle with some cold water in it.
All right, great. Thanks. Now I'm going to spray you with some water. It'll help. I'll lift you up a little bit. Let me get back here.
Here you go.
Greg, do you think you can drink something?
The dispatcher said EMS will be here in just a few minutes.
Actions to help someone with heat exhaustion include: be sure the scene is safe. Send someone to get the first aid kit and AED. Wear personal protective equipment. Call your emergency response number or 911. Have the person lie down in a cool place. Remove as much of the person's clothing as possible. Cool the person with a cool water spray. If a cool water spray is not available, place cool, damp cloths on the neck, armpits, and groin. Have the person drink something with sugar and electrolytes, such as juice, or a sports drink, or water if these aren't available. As we mentioned earlier, heat stroke is a very serious condition that looks similar to heat exhaustion. However, heat stroke is life-threatening, and you'll need to act quickly because a person with heat stroke can die. The signs of heat stroke are confusion, passing out, dizziness, and seizures. Other signs are similar to those for heat exhaustion: nausea, dizziness, vomiting, muscle cramps, feeling faint or fatigued.
Okay, stand back, please.
We were sitting at that park bench and saw him just fall over.
What's wrong with him?
He's soaked wet.
You think he's overheated?
Could be. Either one of you have a phone?
Yeah, I do.
Good. Call 911.
What happened?
Sir, can you hear me?
I gotta get
Let's see if we can get him to the pool. If he's going to a heat stroke, we gotta get him up.
Sir, we need to get you the water, okay? Can you try to stand up for us?
Randy, could you go get the first aid kit and the AED out of the van and bring a sports drink from the cooler? You bet.
Actions to help someone with heat stroke include: be sure the scene is safe. Send someone to get the first aid kit and AED. Wear personal protective equipment. Call or ask someone to call your emergency response number or 911. Put the person in cool water up to his neck if possible. See if the person needs CPR. If he does, give CPR if you know how. It's important to begin cooling a person who might have heat stroke immediately. Every minute counts. If you can't immerse the person in water, try to cool him with a cool water spray. If the person starts behaving normally again, stop cooling him. If you keep cooling the person, it could actually lead to low body temperature. If the person can drink, give him something to drink. A sports drink is best. If he can't drink because he's having a seizure or vomiting, for example, wait for someone with more advanced training to take over. Cold-related injuries may involve only part of the body or the whole body. A cold injury to part of the body is called frostbite. Cold injury to the whole body is called low body temperature or hypothermia. Frostbite typically occurs outside in cold weather. It can also occur inside when workers handle cold materials, such as cold gases under pressure, without wearing gloves. Signs of frostbite are: the skin over the frostbitten area is white, waxy, or grayish yellow. The frostbitten area is cold and numb. The frostbitten area is hard and the skin doesn't move when you push it. When giving first aid for frostbite, move the person to a warm place. Call for help, remove wet or tight clothing, and pat the body dry. Put dry clothes on and cover with a blanket. Also remove any rings from a frostbitten part. There are some things you shouldn't do for frostbite. Don't try to thaw the frozen part yourself if you think there's a chance of refreezing. If you need to touch the frostbitten area, do so gently. Rubbing it may cause damage. Low body temperature, or hypothermia, occurs when body temperature falls. This can cause serious problems or even death. A person can develop low body temperature even when the air temperature is above freezing.
Hey! Who left the delivery in front of the freezer? You blocked the door! Hey! Someone call 911! Grab the first aid kit and the AED, get some blankets from the dry storage.
The signs of low body temperature include: the person's skin is cool to the touch. Shivering. Keep in mind that shivering stops when the body temperature is very low. The person may become confused, have a change in personality, be very sleepy, or not concerned about his condition. The muscles become stiff and rigid, and the skin gets ice cold and blue. As the person's body temperature continues to drop, it may be hard to tell if the person is breathing, or the person may stop responding. The person may even appear to be dead. First aid actions for a person with low body temperature are: get the person out of the cold, remove wet clothing, and pat the person dry.
Get this wet jacket off her.
Put dry clothes on and cover the person's body and head, but not the face, with blankets, towels, or even newspapers. If the person stops responding, call your emergency response number, or 911, and get the AED. Be ready to check to see if CPR is needed. It's important to get the person to medical care as soon as possible. A poison is anything that someone swallows, breathes, or gets into the eyes or on the skin that causes sickness or death. Many products can poison people. You have probably learned about specific poisons at your workplace, and you should follow your workplace guidelines about them. We will not deal with specific poisons, but instead, we'll look at general steps to help someone who has been exposed to a poison. If you think that someone has been exposed to a poison, call your emergency response number, or 911.
Go get help.
They may also connect you with your local poison control center. Get the first aid kit and make sure the scene is safe for you and the ill person. If the scene seems unsafe, do not enter. To see if the scene is safe, look for signs that warn you that poisons are nearby. Look for spilled or leaking bottles or boxes.
Go get them.
Do not enter the scene if you see more than one ill person. Put on protective equipment. Move the ill person from the area of the poison and ask everyone to move away from the area. Help the person to go outdoors or move to an area of fresh air if possible. If the ill person stops responding, call your emergency response number, or 911, and get the first aid kit and AED. Check to see if CPR is needed. Use a barrier device for giving breaths. This is especially important if the poison has contaminated the person's lips or mouth. Wash or remove the poison from the person's skin and clothing if you can do so safely. Help the person to a faucet, safety shower, or eye wash station. Remove clothing and jewelry from any part touched by the poison. Use a gloved hand to brush off any dry powder or solid substance from the person's skin. Run lots and lots of water over the affected area for at least 20 minutes or until someone with more advanced training takes over. Ask the person to blink as much as possible while rinsing the eyes. If only one eye is affected, make sure the eye with the poison in it is the lower eye as you rinse the eyes. Make sure you don't rinse the poison into the unaffected eye. If you know the name of the poison, have someone bring you a material safety data sheet, or MSDS. These sheets tell about harmful poisons at your workplace and can give useful information. You may learn more about the MSDS in the Right to Know course at your workplace. Your workplace may ask that you call the Poison Control Center for first aid instructions when a poisoning occurs. The phone number for the Poison Control Center should be in the first aid kit. Only give antidotes that the Poison Control Center tells you to. You can contact your local poison center by calling 1-800-222-1222. When you call the Poison Control Center, try to have the following information. What is the name of the poison? Can you describe it if you cannot name it? How much poison did the person touch, breathe, or swallow? How old is the person? What do they weigh? When did the poisoning happen? How is the person feeling or acting now? This concludes our discussion of environmental emergencies. By now, you should know how to recognize and respond to several common environmental emergencies, including human and animal bites, snake bites, as well as insect and spider bites and stings. You've learned about emergencies involving both heat and cold, and you've learned how to respond safely to emergencies involving poisoning. The video will now pause so that your instructor can go over some environmental emergency review questions with you. Congratulations! The knowledge you've gained today can help you change or even save someone's life. If you practice your skills often to keep them up to date, you'll have the best chances to help an ill or injured person. On behalf of the American Heart Association, thank you for taking time to attend this important course.